I think if a man sees therapy, it's like, well, I'm supposed to talk about my feelings and just feel better. That doesn't it doesn't resonate as much. It's like, how can I apply this to my life? I need something really tangible, I feel like.
Or even if you're explaining that, like, depending on what it is. So like, let's say somebody has a anger issue and they just snap. And this could, that can be a big issue because you can get fired. You can lose your job or your reputation. It can lead to a divorce or problems with your family. Like that can be a pretty destructive thing. So how do you respond to it? Well, just explaining on some level that, like, it's really helpful to, in the moment when you're angry, to think about what's the trigger here. And a lot of times it's like you feel disrespected, you feel ignored, you feel not heard. Whatever it is, being able to connect to the feeling that's driving the anger can actually diffuse the anger a little bit. And the ability to reflect on it can slow the process down a little. So even if you need to take 10, you need to take 5, and you need to cool off, you can have that process of being like, I'm frustrated because I felt like what I was just being told felt really disrespectful, or I feel like there's nothing I can say to get me out of this, or I feel really shamed or judged, or whatever your triggers happen to be. Then you can speak about the actual issue in a constructive way and address the problem rather than just exploding. And then the problem doesn't get resolved and you end up getting a high cost. So it doesn't necessarily have to be skills only for men. It could be insight-oriented, emotional, process-engaged work. But it does involve, I think, some type of explaining maybe a little bit more about how the process works and why it can be beneficial.